Bismillahirrahmanirrahim. Assalamu alaikum dear students. Welcome to your channel The Anatomy Canvas. In today's class of embryology, we are going to discuss with development of the vascular system. So the learning outcome for the today's class are to describe development of the arterial system and discuss the congenital anomalies in the vascular system. So first of all, a little bit revision from the previous knowledge that the angioplastic mesenchyme, which is going to form the heart and the blood vessels and the RBCs, all of the components of the circulatory system. So it is derived from the extra-embryonic mesenchyme in the region of the allantois, the splanchnopleury of the yolk sac, the somatopleury of the chorion, the peripheral cells flatten as vascular endothelium, whereas central cell transforms into the primitive RBCs. Later, the contiguous islands merge, forming the continuous network of the vessels. So in this diagram, you can see these are the different blood islands. These islands are present in the wall of the yolk sac as well as in the region of the allantois and in the region of the developing placenta. So first of all, a little bit about the early embryonic circulation. Initially, the early embryonic circulation is a symmetrical, so you must remember it is a symmetrical circulatory system. It is modified through development to produce a functioning fetal circulation which is connected to the placenta and changes rapidly at birth to accommodate disconnection from placenta and start of the gaseous exchange in the lung. So in this diagram you can see this is the developing area of the developing heart, and these are the aortic arches and the dorsal aorta which are forming and the umbilical arteries. So this was the initial embryonic circulation which was symmetrical and which later on modifies to so that the for the functioning of the fetal circulation when after birth it is connected to the gaseous exchange is taking in the lungs. So early embryonic circulation, the major restructuring of early vessels occur as the embryo grows. So you can see the anastomosis form in different areas and then they appear and then they reappear. The capillary fuses to form different blood vessels, either arteries or vein, and there is a reversal of the blood flow several times before the final arrangement is taking place. So in this diagram you can see this is the area of the heart which is developing. This is sinus venosus. These are the anastomotic channels in the present in the septum transversum. In this diagram you can also see these are the anastomotic channels present in vitelline areas and umbilical areas, and also the dorsal aorta which is forming over here. So different channels formed by the capillary plexus, then they appear, then they disappear, then they coalesce forming different blood vessels. Then there is the reversal of the blood flow several times so that before the final arrangement of the vessels is completed. So primitive aorta, after the head folding, the embryo has bilateral primitive aorta. So you must remember one is the ventral aorta and other is the dorsal aorta, two primitive aorta. The ventral and the dorsal part that are continuous through first embryonic aortic arches. So this one is the ventral aorta and this one is the dorsal aorta, and they are connected to each other via aortic arch arteries. Ventral aorta are fused and form the dilated aortic sac. So in this area you can see the ventral aorta are fused over here and they are forming the dilated aortic sac. The dorsal aorta run caudally, one on each side of the notochord. You can see here the dorsal aorta on each side of the notochord, and then they the fourth week of development they fuses in from the region of the fourth thoracic vertebra to the region of the fourth lumbar vertebra to form the common definitive descending aorta. In these regions you can see the dorsal aorta degenerates, so the connection of the dorsal aorta, its proximal and distal part is obliterated. So again I repeat, the two aorta are formed, the two ventral aorta and the two dorsal aorta are formed. These two ventral aorta, this one is the right side and the left side, and the dorsal and ventral aorta are attached to each other via aortic arch arteries. So primitive dorsal aorta. The dorsal continuation of the primitive dorsal aorta directs blood into an anastomosing network around the allantois, which will form the umbilical arteries. So in this diagram you can see these are the anastomosing network which are connected to the dorsal aorta, and these anastomosing network will be formed into the umbilical arteries. The blood is channeled back to the developing heart. So this is the way the blood is distributed to the body, and via umbilical artery it is going to the placenta. Then it is channeled back to the heart via umbilical veins, then through the vitelline veins, and then through the cardinal veins. The precardinal or anterior cardinal vein and the postcardinal or posterior cardinal vein, which is forming the common cardinal vein. So these are the three channels through which blood is returning back to the heart. That is umbilical vein, the vitelline vein, and the pre and the post cardinal vein. So this was the basic embryonic circulation, which has initially two primitive dorsal aorta, two primitive ventral aorta, which are connected to each other via aortic arch arteries, and in the region from the region 4th thoracic to 4th lumbar dorsal aorta fuses to form common descending aorta, and it continues as the umbilical arteries. The returning channel is the umbilical veins, the vitelline veins from the area of the yolk sac, and the cardinal veins, the anterior and posterior, also called the pre and the post cardinal veins. They join to form the common cardinal veins. So in this diagram you can also see all of the same arrangement. This is the area of the developing heart. Here you can see the right atrium is present, right ventricle is present, left ventricle is forming, and the right sinus horn is here. And in this area you can see this is the right common cardinal, this is the precardinal, also called the anterior cardinal. This vessel is called post-cardinal, also called the posterior cardinal vessel and vein. Posterior and anterior cardinal veins forming the common cardinal vein. This one is the vitelline vein, the right and the left vitelline veins, returning the blood to the heart, and these are the umbilical veins, the right and the left. So the three veins, the umbilical, vitelline, and pre and post cardinal veins, which are the channels through which blood is returned back to the heart. So first of all we will do the embryonic arteries. So each primitive dorsal aorta gives rise to four major type of the vessel. The first somatic, then the umbilical, then the lateral splanchnic, and ventral splanchnic. So the somatic one, also called the intersegmental branches to the body wall. The umbilical arteries are the caudal continuation which passes into the body stalk. Lateral splanchnic are the paired segmental branches to the area of the mesonephric ridge, that is supplying the area of the developing kidneys as well as area of developing gonads. And the ventral splanchnic arteries are the paired segmental branches to the digestive tube. So please, dear students, do remember that these all points are not given in the book, but they are very important from MCQ's point of view. So please listen carefully. These are all MCQs. The somatic arteries, also called intersegmental to the body wall. The caudal continuation after passing into the body stalk is the umbilical artery. The lateral splanchnic arteries are paired segmental branches to mesonephric ridge. And the ventral splanchnic arteries, these are the paired segmental branches to the digestive tube. Little bit detail about these. So first of all, the somatic arteries. Here you can see this is the somatic artery. Then it divided into two branches, the dorsal branch and the ventral branch. The dorsal branch goes on sides of the neural tube and supplies it, and the ventral branch comes to the body wall. So these are somatic arteries. These are almost unchanged in thoracic and lumbar region and forming the posterior intercostal arteries, the subcostal and lumbar arteries. So please remember, these are your MCQ, that the posterior intercostal, the subcostal and lumbar arteries, they are derived from somatic arteries. Now the early umbilical arteries. These early umbilical arteries are the direct continuation of the dorsal aorta into the umbilical cord. So these are the second branches of the dorsal aorta, direct continuation of the, basically continuation of primitive dorsal aorta. Here you can also see these are the umbilical arteries which are continuation of dorsal aorta. Here you can see different intersegmental arteries, also called the somatic arteries as well. And here you can see these are the vitelline arteries which are coming to the yolk stalk. So lateral splanchnic arteries, these are here you can see in this diagram. This one the somatic or intersegmental, and this one is the lateral splanchnic branch. These are also paired branches from the dorsal artery. These are basically the gonadal arteries, that is in the male these are testicular arteries, and in the female these are the ovarian arteries. Then the three suprarenal arteries are formed from these lateral branches of the dorsal arteries. From the most cranial suprarenal artery, phrenic artery is formed, and from most caudal suprarenal artery, the renal artery is formed. So please again remember, these are all your MCQs. Then the ventral splanchnic branches. So this is the ventral branch. Okay. This branch is supplying the gut tube. So please remember, these ventral splanchnic branches they run in mesentery, and in the area of the foregut they are forming celiac trunk. In the area of the midgut they are forming superior mesenteric artery, and in area of the hindgut they are forming the inferior mesenteric artery. So these are the different branches of the dorsal artery. So again I repeat, this is the dorsal aorta. This one is the somatic branch, also called the intersegmental, which gives off two branches, dorsal and ventral. Then the lateral splanchnic branches supplying the gonadal areas and mesonephric areas, and then the ventral splanchnic branches, and the terminal continuation are the umbilical arteries. So now we move on to the aortic arches, which is the major system forming all of the main vessels in the cranial area of the heart. So before understanding the aortic arches, first have a look on this diagram. So first, as the aortic arches are forming, at the same time pharyngeal arches and pouches are forming. These are the longitudinal section, and these are the cross section of the pharyngeal arches and the pharyngeal pouches. These are just like gills of the fish, which are forming in the fish in human beings. These are modified. We will study these pharyngeal arches and pouches and their development in the head and neck region. Here, just to remember that we have 1, 2, 3, 4th and 6th pharyngeal arches and pouches, and each of the arch has its own artery, its own nerve and its own cartilage. So first pharyngeal arch has first aortic arch, second has second, third has third one, fourth and sixth. Fifth never form, or if it forms it obliterates very early. So actually we have 5 arches, but we number them as 1, 2, 3, 4 and 6. Similar about the aortic arches as well. So now if we move on to the aortic arches. First, we will understand these aortic arches through this diagram, and later we will study all of these individually. So first look at this. This is the ventral aorta and this one is the dorsal aorta. This is the left side, this one is the right side. So and these ventral aorta fuses, their proximal part fuses to form the aortic sac. So first aortic arch is the connection between the ventral and dorsal aorta, and it almost obliterates, just forming the maxillary artery. Similarly, second aortic arch also completely obliterate except for a small branch, that is the stapedial and the hyoid artery. So what happens to the third? This one is the third aortic arch, which has connection with the dorsal aorta and the ventral aorta. So this part of third aortic arch, look at this part over here as well as here, up till third aortic arch there is a common development on both sides. So third aortic arch, this part will give rise to proximal part of internal carotid artery. Remember please, and this area, which is the part of the ventral aorta, arises as a sprout from the ventral artery, and it will form the external carotid. And ventral aorta, between the junction between the third and fourth aortic arches, will form the common carotid. So again I repeat, the third aortic arch will form proximal part of internal carotid. Here you can see in this diagram as well. This is the junction of the ventral. This is a junction formed by the ventral aorta between third and fourth aortic arch, and it will form the common carotid. And from this junction a sprout appears which will form the external carotid. So remember, this is common carotid, this is common carotid. This blue color area shows derivative of third aortic arch, and this white shows a sprout from the junction of the ventral aorta between the roots of third and fourth. Behind the fourth aortic arch and the sixth aortic arch, ventral arches fuses to form the aortic sac. Also remember, the dorsal aorta between third aortic arch and fourth aortic arch also obliterate. So what happens to the fourth aortic arch? That this fourth aortic arch on the left side will form the arch of aorta. Here you can see arch of aorta, and this is the between the junction, but the part between the common carotid artery, left common carotid artery, and here is the left subclavian artery. So later on this will move over here and this part will be reduced to a small part. So this is the derivative of the fourth aortic arch on left side. Both the derivatives of the fourth arch and the sixth arch are different on both sides. On right side they are different derivatives, on left side they have different derivatives. So on the left side, fourth aortic arch is forming part of the arch of aorta between the origin of the common carotid and the subclavian artery. On the right side, this is the color, pink color, light pink color is showing you the fourth aortic arch, this area. So this fourth aortic arch on right side is forming the proximal part of the subclavian artery. So remember, this is proximal part of the subclavian artery. These are the intersegmental areas. 3rd to 7 intersegmental area on left side will contribute to arch of aorta, will fuses will form later on and contribute to the left subclavian artery, and here on the right side from the area of 3rd to 7 will contribute to the distal part of the right subclavian. So remember, right subclavian artery, proximal part is formed from the 4th aortic arch. distal part is formed from the 3rd to 7th intersegmental part of the dorsal artery, and this area is formed from the again this is the internal thoracic, and this will form the right subclavian artery. The area between 8th to 9th where the junction is taking place, so this area of the descending dorsal artery on right side will be obliterated. So now we move on to the 6th aortic arch. 6th aortic arch is also called the pulmonary arch. Initially, this pulmonary arch is connected to the dorsal artery on both sides, but later on the right side, this disappears. This before it disappears, it gives branch which is called the right pulmonary artery to the developing right lung, and on this side the left pulmonary artery which will go to the left lung. So after the giving these branches, this area will disappear. So here you can see there is no left, there is no part over here, but on the left side this area will persist and will form a connection. This is the ductus arteriosus. When the 6th aortic arch is forming, so as I have told you, this is the aortic sac which is formed by the fusion of the ventral aorta between the origin of the 4th and 6th aortic arch. So when 6th arch is forming, at the same time aorticopulmonary septum is developing, and this aorticopulmonary septum is dividing the aortic sac into aorta and pulmonary trunk. When these two develops, then the pulmonary trunk because is connected from the right side of the heart via ductus arteriosus to the descending aorta. So this will be now the channel which will in fetal life, in embryonic and fetal life, this will transmit the blood and the oxygenated blood from the right ventricle through the ductus arteriosus into the descending aorta to the all of the body. So this was the channel. This ductus arteriosus after birth closes. There is proliferation of the intima and it is closed, which will form ligamentum arteriosum. Another very important point you people must remember that the branch of the vagus nerve, which is the recurrent laryngeal nerve, it initially hooks around the 6th aortic arch. This is right side and this is left side, and the 6th recurrent laryngeal nerve will hook around it, and then it will ascend and it will supply the 6th pharyngeal arch. So when this 6th aortic arch obliterates on the right side, the right recurrent laryngeal nerve will move upward, while on the left side, as ductus arteriosus is present, so left recurrent laryngeal nerve is present over here, and it will hook around initially ductus arteriosus, and later when it will form the ligamentum arteriosum, it will hook around the ligamentum arteriosum. So these are the different branches. The internal carotid, I repeat, internal carotid, external carotid, common carotid, arch of aorta, the aortic sac, and the right subclavian is forming here. The left subclavian is forming from 3rd to 7th intersegmental. Then the arch of aorta, this left dorsal aortic root forming the part of arch of aorta, and then descending aorta. So dorsal aorta obliterated over here, again over here. This is this artery which is forming as the this is the vertebral artery. Here you can see the vertebral artery is forming over here, and this is again the vertebral artery you can see. So again further modification of these vessels occur because of the elongation of the embryo, because of the head folding, and also because of the head folding, the heart descends into the thoracic cavity so that the origin of these vessels changes. So what happens to origin of these vessels in later stages? We see in the next slide. So here you can see, because of the descent, this was the part which was originally derived from fourth aortic arch. Now it comes to lie between common carotid and the subclavian artery. This is the part which is forming the brachiocephalic trunk formed from the ventral aortic root. This is the right subclavian artery, and these are the arch of the aorta. Here is the ligamentum arteriosum, and the pulmonary and the aortic vessels are present. So these are the different vessels. I have explained you through the diagram, and now I will do each of the arch separately so that you can understand easily. So first aortic arch disappears almost completely. Small part persists, forming piece of maxillary artery. Again your MCQ. Second aortic arch disappears. A small portion persists and contributes to hyoid and stapedial artery. Again your MCQ. Third arch has the same development on the right and left. It gives rise to initial portion of the internal carotid, the external carotid, and the common carotid. Fourth aortic arch on left side form part of arch of aorta, on right side form proximal segment of the right subclavian artery. Fifth aortic arch disappears completely. Sixth aortic arch, the pulmonary arch gives off a branch on each side that grows towards developing branch. These are the pulmonary arteries. Right side proximal part forms right branch of pulmonary, and distal disappears. Left side, the distal part persists as ductus arteriosus in intrauterine life, and later on after birth, when this channel will close, it will form the ligamentum arteriosum. Proximal part gives rise to the left branch of the pulmonary artery. Here is the proximal part of the sixth arch, which will form the proximal part of the left branch of pulmonary artery. So these are all aortic arches. Now a table just to repeat. First aortic arch derivative maxillary artery, second hyoid and stapedial, third common carotid and first part of internal, fourth arch on left side part of arch of aorta, fourth on right side right subclavian, its proximal part, sixth on left side left pulmonary and ductus arteriosus, sixth on right side right pulmonary artery. Again a revision slide. So what happens in the aortic arch pattern? Again you can see this was the initial and this is the final. This is left common carotid, this is right common carotid, this is the brachiocephalic trunk, this is left subclavian artery, this is the ligamentum arteriosum, and pulmonary vessels, the left and right pulmonary arteries, and ascending aorta. So again a repeat. Aortic sac forming proximal part of aortic arch and brachiocephalic. Here you can see this area which is formed from the aortic arch. First maxillary arch forming the maxillary artery, second forming stapedial and hyoid, third forming common carotid part of internal and external carotid, fifth fails to form, and sixth on right side will form proximal part of the right subclavian artery. Rest of it is formed from the seventh intersegmental and right dorsal artery, and fourth arch on the left side is forming the arch of the aorta. This area you can see. And sixth arch on right side forming right pulmonary and distal segment regress. On left side it forming left pulmonary and distal segment persist as ductus arteriosus. So now we move on to the anomalies, very important anomalies. So first, double aortic arch abnormal. In this there is the persistence of the right distal segment. So this segment normally disappears, and when it persists, there it is called the double aortic arch, and as it persists, it is compressing the esophagus and the trachea, so there will be dysphagia and dyspnea in such patients. Then the another anomaly is the right aortic arch. In this case, the portion in the 3rd to 7th, 8th intersegmental artery and the junction of two, on the left side it obliterates and on right side it persists. Usually it is asymptomatic. Apparent right subclavian artery, sometimes this area of the dorsal aorta on the right side disappears, it obliterates, which normally present, and this part persists, and this subclavian artery is arising from here. It moves then behind the esophagus and the trachea, and its origin come to lie below that of the left subclavian artery. This is left subclavian and this one is the right subclavian. So right subclavian come to lie below the left subclavian artery. This is a rare anomaly, and it is also associated with dysphagia and dyspnea, and in most of these cases there may be persistent ductus arteriosus. So another is interrupted aortic arch. In this case you can see this part of the aortic arch will disappear, and also in this part it will disappear. So aberrant regression of the left fourth arch and output of the left upper limb trunk and both lower limb is via pulmonary trunk. So you can see this is the pulmonary trunk, and it will give rise to branches to the upper limb and lower limb. Rather asymptomatic at first, but ducts starts to close during 2nd week of the life, so needs to be cut and fixed by surgical reconstruction. So when this ductus arteriosus will close, so there is a need to reconstruct all of the thing. There is neural crest etiology as well in general population, but rather common in patient with DiGeorge syndrome, that is 22q deletion syndrome, because in such case when there is the interrupted aortic arch, the reason is neural crest cells which are affecting. So there will be defects in the aorticopulmonary septum and also in the interventricular septum as well. Another is coarctation of the aorta. Coarctation of aorta may be because of the proliferation of the intima and media that will lead to coarctation and closure of the aorta. So this coarctation of aorta again has two types. Either it can be post-ductal or it can be pre-ductal. So post-ductal mean after the origin of the ductus arteriosus, and pre-ductal mean before the origin of the ductus arteriosus. Collateral circulation can compensate. In this case you can see these are the collateral vessels which appear. The ductus arteriosus always persist. Intercostal vessels are enlarged and blood is supplied to the upper limb and head and neck through these vessels. Then there may be common brachiocephalic trunk. In this you can see common brachiocephalic trunk from which both right and left subclavian arteries are rising, and then the left vertebral also rising from here, left common carotid and left and right common carotid arising from the bicarotid trunk. So this is another anomaly, and another anomaly is the patent ductus arteriosus, which is usually associated with many anomalies, and ductus arteriosus persist, and there is a shunting of the blood from right side of the heart to the dorsal aorta. So students, here is a surprise test for you people, so that you may prepare for your exam. The embryonic aortic arch vessels form some arteries in which of the following areas of the body: the neck, the pelvis, the lower limb, upper limb, or the abdomen. So you must answer me through WhatsApp as well. Arch of the aorta is formed in part from which vessel? Arch of aorta, remember, it is left third aortic arch, right third aortic arch, left fourth aortic arch, right fourth, or you know, don't know. The right subclavian artery, right, look at this, this is the right one, is formed from all of the following except the right fourth aortic arch, right 6th aortic arch, right dorsal aortic, and 7th intersegmental. Either you don't know. Then the descending thoracic aorta is formed from which structure? This is descending, remember. Dorsal, right dorsal, left dorsal, aortic sac, two of the above, the right and the left dorsal. Humans do not have a set of dash aortic arch vessels, first, second, 5, 6, third. So this was your surprise test. You can answer me through WhatsApp, through YouTube channel as well. These are the references: the Langman's Medical Embryology, The Developing Human by Keith L. Moore, and The Gray's Anatomy by the Susan Stranding, 40th edition. Thank you very much for your attention. It was a lengthy class. You may be bored, but still thank you very much for your attention. Allah Hafiz till next class.